Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Are you losing your hair like everyone around you? Well, you're going to want to stick in for this show today. Welcome to Accelerated Health with Sara Banta, where I cut through the noise and fast track your journey to better health. I'm your host, Sara Banta, CEO and founder of Accelerated Health Products and certified by the National Association of Nutritional Professionals. I'm here to share the latest on supplements, wellness hacks, and natural health solutions that actually work, from boosting energy to detoxing to balancing hormones and hair growth. And I will help you reach your optimal health. So let's dive in. Super excited to have Dr. Alan Bauman. He is a board certified hair restoration physician with over 28 years of experience and founder of the Bauman Medical, a global recognized leader in hair loss treatment. He has treated over 34,000 patients, performed 12,000 hair transplants, and administered 12,000 or more PRP hair growth procedures. Welcome, Dr. Bauman. I'm so excited to have you here. I wish I knew you 20 years ago. And for those of you who don't know me and who weren't in high school with me, I had this gorgeous, long, thick hair until puberty. And then I will never forget junior year, Sky Harris sitting behind me in psychology class said, "Oh, Sara, you're going bald." And I go, "What?" And that was like, okay, now I was really zeroing in on my scalp, and hormones just kind of made the hair go away, get thinner and thinner and thinner, had 3 babies, 3 pregnancies. And that just destroyed my scalp. And this is before it really was that big of an issue for women, or maybe we just didn't think there was anything to do about it. And so it wasn't a big deal. It wasn't something that women talked about. And I was so embarrassed, and I had a lot of other health issues, but the hair was the most important because I had to look at it every day in the mirror. So welcome today. I'm so excited for you to share your tips and tools. And, we know there's not just one magic bullet, but we're going to talk about all things. So welcome.
Thank you, Sara. It's really great to be with you. And wow, kudos to you for sharing your hair loss journey. Hopefully we can get into, why maybe hair loss in women was kind of overlooked, for so many years, and people thought hair restoration was just a man thing. Certainly it affects just as many women, if not more, than men here in the United States and around the world. So it's a big, important issue, and hair is a very emotional organ, and I'm sure we're going to get into all of that.
Oh my gosh, emotional in so many ways. You get stressed out or you have a bad day, your hair's going to fall out. I literally can feel my scalp either growing or shedding depending on my mood. And my issue was I had PCOS. I also probably wasn't eating enough protein. I was also stressed. I was a type A personality. So I had probably a ton of factors. And to give everybody hope, I'm 49 years old. I'm in that hormonal roller coaster of the age, and my hair, it might be not amazing, but it definitely is thicker than it was in high school. So what I've done, and the thousands of dollars that I've spent on stuff that doesn't work, a couple things that do work, but you have, it's almost like as I've listened to you and seen what you're doing, you have fine-tuned what I did, but to a whole nother level. So super excited. And my son is going to be very excited too, because we've got it on the other side, in the other gender of my family. And my girls looked at pictures of me when I was younger and go, "Oh God, am I going to have that issue too?" So hair is a huge topic in our family and across all of my clients. Even the people, and I'm sure you're seeing this with the spike protein in the pandemic.
Oh, absolutely.
The disruption of the food supply. We don't even eat real food anymore. The toxicity, the fluoride in the water, the pollution in the air, and then just the chronic stress we're all under, so many people who have great genetics for hair are losing their hair. So it seems like it's massively affecting the population.
No, it's a big epidemic. Hair loss is obviously a big issue, and I'll tell you, in the nearly 30 years I've been in practice, the younger generations seem to be having more and more hair loss as it goes along, and this is something that we saw creeping really younger and younger as the years went along in my practice. That wow, we're these younger kids who are really dealing with a lot of hair loss situations. I mean, to the point where today, it's not just some middle-aged guy, thinking about his change of life, or a woman in menopause, but we see women in the years of childbearing age, PCOS you mentioned, which is the most common hormone abnormality in that age category and gender. But we also see young men in high school years going off to college with a bald spot. I mean, it's unbelievable that we're seeing this kind of dysregulation of the hair follicle. And it just goes to show really that the hair follicle is a very sensitive organ to many different things. And it's an outward sign of not just youth and vitality, because certainly it's like an age barometer, right? But it's also a health barometer. Mm-hmm. And so many of those things that you mentioned previously are essentially either toxic or dysregulating the hair follicle, whether it's whole body inflammation, even sleep-wake cycle disruption can throw off the hair follicle cycling. Certainly nutrition, are you feeding yourself enough good nutrients and fuel to actually build hair? I mean, that's like, it seems rudimentary, but if you're protein deficient, and we talked about this off the air, you're not going to grow good hair. And that it just seems pretty basic. So the hair follicle is very sensitive to all of these things, and including hormones, right? Which are the reason for typical male and female pattern hair loss. But we treat a lot of other things too, autoimmune hair loss and so forth. And hair loss caused by styling, issues, chemicals and heat, and actually even just traction or tension and hair extensions are commonly being used, much to a woman's detriment in terms of her hair long term.
Yeah, I want to start with the nutrition aspect, because this is the basic. And I had someone email me yesterday, and she wants to lose weight. And she said she tried Ozempic and she stopped it because of the hair loss. Now, does Ozempic actually cause the hair loss? No, it's the restrictive diet, the lack of protein, and the body recognizing, hey, I'm not getting enough fuel. I'm going to shut down what I don't need. I don't need my hair. I don't need my nails. I need to focus on my liver, my kidneys, my gut, my expensive organs, and I need to shut down the metabolism. And so there's this halting of all of those fun vanity mechanisms in the body. And that's why if you go through a divorce or you have a death in the family, you're going to lose your hair a little bit. That doesn't mean it can't grow back. There's things to do, but I want to start with the nutrition aspect. So what are the basics that you look to make sure that you're supporting your hair?
Yeah. And so let's just talk, real quick about how highly metabolic this cell population is. I mean, you're born with about 150,000 hair follicles on your scalp. They produce hair at about a quarter to a half inch a month. So what does that mean in terms of timing and amount of energy that your body dedicates to hair? Think about this. Listening to an hour-long podcast, they've already grown 6 feet of hair on their head if their head of hair is healthy. And so there's a lot of metabolic commitment. And you mentioned that if you're caloric restricted, your body's going to shift towards more critical organ systems, and there's no question about that. So nutrients and fuel, as we said, the backbone is protein intake, and we know that protein is critical to maintain muscle mass, to maintain your bones, to maintain your brain function, and all of the other functions in your body. But certainly, your hair is a barometer of the caloric intake. Once you start cutting that back severely, you're going to see it happen. And it didn't just start with Ozempic. We knew this was happening way before we had drugs for diets, so to speak, and the skinny shot. So just as an example, I don't know if you remember, bariatric surgery went kind of through a surge where people were getting stomach stapling and then the balloons and sleeves and so forth. And what was happening is you get a much smaller, stomach out of that, and you basically would get fuller faster and you wouldn't be eating as much. And of course, these folks would lose hundreds of pounds potentially over the course of a year. But what they did notice is that there was a severe impact on their skin and their hair. And it's because these are highly metabolic organ system, highly metabolic metabolic mini organ systems that are responsive to the amount of fuel and nutrient intake and absorption also, by the way. So if you're not absorbing very well, that's also going to create some havoc in your hair follicle. So, those are all really important things. And of course, we can talk about B vitamins and zinc and biotin and so forth. All of these things are very, very important when it comes to growing good hair and even circulation. Because think about it, you've got the hair follicle, which needs a certain amount of building blocks. Then you need oxygen. Oxygen is carried by the blood circulation. If your circulation to the skin is poor, if you're a smoker, God forbid, you're cutting down on the blood supply. That sprinkler system to the garden, if you will, if you catch the analogy, is really becoming restricted. So in my practice, we have a variety of supplements that we would apply if we find that the person is, let's say, nutrient deficient. And this could fall into a category of, an undergraduate college student, let's say, who's, eating junk food and not sleeping well and all of that business. Let's get them some good protein supply. We have Builder Collagen. We can put a B complex, we call A-list, which are the multivitamin that we use. We can supplement with a higher dose biotin if we need to. Those are just some of the very basic things. If they're dysregulated in terms of their microbiome of their gut and they have inflammation there, maybe we put them on a good probiotic, settle that all out. But the nutrients and fuel are really, really critical. So whether you have had bariatric surgery, you're going on Ozempic, or you're even on some caloric restrictive diet, or even if you're a vegan or vegetarian, you might have a hard time getting enough protein into the system. I'm not saying you're not getting enough protein into your stomach, but even just, translating that into your body, it can be a problem.
Yeah, I love that you said translating into your body, because it's not just known. It's not just absolutely going to be happen that whatever you eat is going to translate and assimilate in your body. If your gut's not working, if you've got leaky gut, or if your liver's backed up, things just that there might be something in that wheel that is not letting it turn. The one thing I wanted to stress and emphasize is essential amino acids and collagen are needed. They're separate. Collagen is a protein, but collagen doesn't necessarily build your muscles. There's different jobs that they both do. Can you explain the role of essential amino acids and collagen and how they're both needed?
Yeah, well, the good thing about collagen, there's been some debate of whether these collagen molecules are actually absorbed in the way that they're provided, or do they break down into the amino acids, which are the building blocks of the collagen and other proteins in your body. And collagen proteins are certainly not all inclusive. There are some missing pieces of that puzzle. You're not getting every essential amino acid with just collagen supplementation. But we do know that there are certain manufactured and proprietary collagen formulas that have been shown in clinical trial work to improve joint health, for example, or skin health or hair. And so those are the very specific ingredients that I look for if I want to provide collagen to my patients. I want to know that this particular collagen or multi-collagen mixture has some science behind it. And so that's the only way we're going to either put our name on it, so to speak, or recommend something to our patients. But yeah, that's really important. And, and today a lot of people are also talking about nutraceuticals, which are, maybe fall into the category of ancient herbs, right? So things that are non-pharmaceutical that actually have a very strong or proven to have a strong biologic effect, whether it be ashwagandha for stress or curcumin turmeric for inflammation. These are all, can be very important depending on your situation. And that's why, if someone's having a hair loss issue, it takes a lot of time to kind of dissect through all of these things. And that's one of the things that we do in the practice here at Bauman Medical. Before we even put a camera on your scalp, we're going to talk to you a lot about what's been happening. Are you seeing excessive shedding? Has there been any kind of change in your diet? Have you had a recent surgery like general anesthesia exposure? Have you been jet lagged? Have you had a vaccination? Have you had COVID? These are all things that can dysregulate your immune system and other systems in your body that are critical to make your follicles do what they are born to do, which is to grow beautiful hair.
Right. And just all the things that you mentioned, they are stressors on the body. And what does the body do when it stresses out? It sends that energy to take care of whatever the stressor is and takes away the circulation and the energy to the hair follicles. And circulation, I notice when my thyroid is down, because my thyroid can go up and down. When my thyroid's down or my lymphatic drainage is down and circulation is down, I feel like my hair is limp and weak. And dead compared to when all those things are running smoothly. So do you see a lot of connection between thyroid dysfunction and hair loss?
Oh, absolutely, we do. We know that when we fix the thyroid and the thyroid is in a better shape, let's say reduce inflammation and thyroid function can resume, or even if you're supplementing with thyroid supplements or even sometimes medication, you can get an improvement in your hair. So that's one of the things that we want to look for. There's no miracle cure for thyroid imbalance. And sometimes I think even if it's thyroid supplements or even medications, it's not really duplicating exactly how the thyroid was meant to work. If you think about the thyroid as kind of a thermostat, you want to keep the temperature at 72 degrees in your apartment or your house. Sometimes when you're on a thyroid supplement or medication, injection, whatever, the thyroid levels are bouncing up and down. And I'm not so sure the hair follicles like that either, to be honest, but the alternative to have some very, very low thyroid or being even hyperthyroid can be detrimental to your hair as well as so many other organ systems. So you've got to take a look at that for sure.
Right. Well, then you've got the case of my 22-year-old son who we've got genetic baldness in our family, and his testosterone's awesome. Like, he can build the muscle, he can do all the things he wants to do. We know that we're seeing in society testosterone's declining. So that's another issue. And it just shows that hair needs that right balance for hair growth, not too high, not too low. But he's sitting there going, Mom, what shampoo should I use? What topical can I use? Because he eats plenty of protein. His diet is amazing. He's not a big drinker. He works out. He's healthy. So all of the lifestyle things, the supplements he's doing, and is he just destined to go bald if it's in his genetics?
Well, no, you don't have to accept your destiny, especially not when it comes to male pattern hair loss or female pattern hair loss, which is actually the main thing that we treat at Bauman Medical. So 98% of our patients come in, they have a very strong hereditary component to their hair loss situation. And of course, yes, we've talked about all these other lifestyle factors that could influence it. But if you think about what causes male pattern baldness, we know that there's a trigger in your body. Testosterone is converted to DHT. Dihydrotestosterone is the primary trigger for male pattern hair loss. And we know this because if we inhibit the production of DHT, even just lower it about 60 to 75%, we actually get a 90% success rate in helping men keep their hair for the long run. Mm-hmm. So, and that's obviously a pharmaceutical intervention, but it's only simply a medication, right, that could be used. And that medication is very successful. So finasteride is the medication I'm talking about. It lowers DHT significantly, not all the way down. There's actually other stronger medications that you could potentially use. But that medication has a very, very powerful success rate in the early stages of male pattern hair loss. As long as you have some hairs to preserve, 9 out of 10 guys will look the same or better for the long run. That's pretty good. And 2 out of 3 will actually regrow some hair. But there's plenty of other things to do. Many folks are worried about side effects with finasteride, especially maybe even in younger men, for example, but even men of middle age and older can be concerned about a 2% chance of sexual side effects with finasteride, even though they're mild and reversible. It comes out of your system in a week if you have an issue. So every person that comes through the door has to decide, is the juice worth the squeeze, right? What's the risk and benefit? And should we be on medication that has a 90% success rate, even if it has a 2% chance of side effects? Is it worth it or not? And we can also apply finasteride topically if someone is concerned about systemic absorption. And then let's not forget about Minoxidil, the OG, as we say. The original FDA-approved medication was a Rogaine, really. That was the active ingredient, Rogaine, as a topical. But today we can microdose it as an oral medication. And that's been a game changer. That has no sexual side effects, very powerful for hair regrowth if dosing strategy is used carefully for both men and for women.
Wow. So that is a microdose oral dose.
Minoxidil.
This is interesting. I've not heard that. And you are not seeing any side effects from this?
Well, I have to tell you that if you're aggressive with for example, minoxidil dosing, and you go too high, and a patient, let's say, is over 60 or 70 years old, you can see side effects like lower blood pressure, higher heart rate, water retention. Some women who are on a low dose minoxidil do see hair growth in unwanted places. So they may have a little bit more hair around the sideburn area, or on their chin or on the upper lip. And sometimes they already kind of knew that they were prone to that ahead of time. So it usually comes out in that conversation before we start that medication. But if we keep it at a microdose level, those side effects are a non-issue. They really is a very, very safe, very effective way to stimulate the hair growth. And so that's been a game changer for many patients. But there's a lot of in between there. So it's not just nutrition and medications. We've got low-level laser light therapy. We've got regenerative medicine technology. We can apply growth factors and peptides. All of these things are very, very powerful in terms of keeping or enhancing the hair that you have. So in the case of your son, we would have a deep discussion. What are the things that you're doing that might be throwing off the hair follicle situation, even though you're an athlete? We have a lot of professional athletes that come in with hair loss. Don't get me wrong. If he's using creatine, there is a little bit of evidence out there that creatine increases DHT production. Mm-hmm. Again, is it a poison? No. It's not, the creatine's not a poison, but maybe that's something you wouldn't use as much, or maybe you just cycle it, or maybe you wouldn't use it at all. But you make those decisions based on the available research, because there is some research out there that links creatine to increased DHT, which again is the bad guy if you're susceptible, if you're sensitive.
What is the mechanism there between creatine and DHT?
Oh, that's a great question. We have no idea. So that's one of the reasons why people say, oh, well, it's never been proven. Well, it's just because we don't know the mechanism doesn't mean that we don't know that it occurs. Because certainly these the research that's often cited when it comes to creatine and DHT are these rugby teams that were treated with creatine, and then they measured literally the DHT levels in the blood. Now, they didn't track their hair loss, understandably. They didn't track whether they were at risk for hair loss. They probably didn't even ask that question. But they did notice in those blood levels that DHT was elevated. So until someone shows me another study otherwise that has no effect, that the creatine doesn't have an effect on DHT, I still have to use what I consider my black box biohacking methods, which is basically you put this in over here and you watch what comes out over here, And so if you put creatine in on this side, what comes out over here? More DHT. I don't know why, but that's what happened.
And then what about supplements like Palmetto to bind the DHT? Because I've heard of a lot of men say, well, I'm going to take testosterone to boost my testosterone, but I'm also going to take Palmetto to bind up the excess of the DHT, so that I don't get the negative side effects that you're getting from the growth in muscles and energy from the testosterone.
So I'm not against saw palmetto at all. I mean, there's been some data that shows that it can have an impact on DHT. In fact, I've seen some patients in the practice, remember, I've treated quite a number of patients who have had sexual side effects from taking massive doses of saw palmetto. Mm. But, the weird thing is that saw palmetto seems to affect everybody a little bit differently. Some people get a response from a very low dose, and then some people need like this huge mega dose. So I'm not so sure we really understand how saw palmetto should maybe be prepared. Which part of the plant are you using? How is it being extracted? I mean, these are all ancient herbs, and probably the, traditional Chinese medicine probably has a better idea of how to produce good quality saw palmetto. But the point is that what you're getting in the bottle out of Amazon, who knows what's in there? I mean, I just think that there's a lot of guesswork as to, even if it says saw palmetto on the bottle, I don't even know if that's actually in there, because no one's third party tested it.
Yeah, you're speaking my language. I talk a lot about the fact that 95% of the supplements out there are trash. They might be fairy dusting the ingredient in the supplement so they can put it on the label. You don't know where it's coming from, if it's dried and dead, where herbs need to be alive and carry that energy, the life force, and are they synergistically working with the other ingredients in there? And then what about the fillers and the other toxins that are in the supplements that are backing up your detox pathways and making the supplement not work and actually backfire. So yeah, you've got to know where you're getting your supplements from. But let's get into now the more exciting stuff. We need to eat our protein. We need to focus on collagen. We need our sleep. We need, good gut health. We need to lower our stress, all the things. We understand that. All so easier said than done. But, right? I mentioned before we came on, because I felt like I was the only woman in the world losing my hair in my 20s, and every pregnancy just stole even more nutrients out of my body, and my hair just kept falling out. I thought I was going to be wearing a wig by the age of 30. And I was using a red laser cap. And probably the only one that was on the market back then. It was, 25 years ago. But I actually think it worked. And I now know, I'm sure the technology is 1,000 times better today. So why don't you talk about the different biohacks, the exciting stuff, the technologies that people can use, and that hair loss, like I'm laughing at my son when he's complaining about, worried about his hair. I'm like, do you understand what's at your disposal for your hair? This is not going to be your issue. You're going to be totally fine. You're going to have a full head of hair regardless, because there's so much out there. So let's get into the exciting stuff.
Yeah, it's so true. I mean, the changes and advances in the world of hair restoration have just been coming fast and furious, and I think it's going to continue. Way back when, no one in medical school taught me that red light had any kind of effect on a hair follicle, much less any organ system in the body. Well, the only thing I knew about light being turned into energy was photosynthesis, and from what I knew is that it wasn't going to happen in a human. But later on, I discovered that actually red light can have a powerful effect on organ systems. It can increase blood flow, decrease inflammation. And we know now how well it can affect hair. So if the follicle's dead and gone and it's beyond repair, the DHT has killed the follicle, it's not going to produce a hair again, it's too late for red light therapy. But if you're in the early stages, if female pattern hair loss in particular does not typically result in baldness, usually it's a diffuse thinning or a weakening of the hair follicles. So women do very, very well in the early stages of hair loss with low-level laser light or photobiomodulation, red light therapy. And so do men in the early stages of hair loss do very, very well with light therapy. Red light has no side effects. It is completely pain-free. And yes, the devices have changed enormously over the years, so much more powerful. But also, we have so many more knockoffs and watered-down devices in the industry than ever before. I mean, if you think you're going to get, if you're going out shopping for a TV, if you think a $5,000 TV is the same as a $500 or $400 TV, I mean, seriously, you need to check yourself, because electronics just don't work like that. You need to invest. If you're thinking about a laser, try to get a good quality medical grade laser. That means one that was designed by physicians or PhDs, tested clinically in a clinic, and also under the guidance of a physician, so that we can actually track and measure your progress over time. So one of the things in the office that we do upon an initial evaluation is we put a camera on your scalp, and we can actually count the hairs with the AI-powered microscopes, give us density and hair caliber measurements. So this is a very powerful way in many different areas of the scalp to get a sense on what's happening in some of the bellwether areas. And then we also physically measure a hair bundle in each different zone. So a lot of women complain, oh, my ponytail is shrinking. Well, what if you made a scientific ponytail in 6 different areas of your scalp, and you could see how those ponytails were changing over time, either getting better or staying the same, or God forbid, decreasing? Those are the kinds of measurements that we do when we're tracking our laser therapy patients. So the Bauman Turbo Laser Cap, that's the premier device. It's portable, it's powerful, it's got over 300 diodes, it covers 25% more area than any other device on the market. And it was designed by Dr. Michael Rabin, originally, the original inventor of the laser cap, which he designed back in, I think, 2008 already. Been some time. So 20 years ago, maybe you had one of the originals from Cleveland.
I was trying to think. Maybe I did.
It's possible. But the new one is completely collapsible and portable, and you should take it with you, obviously, if you're traveling. And it's just 5 minutes a night. And patients often say, well, how quick am I going to see results? Well, it's not an overnight bit of business to grow hair. Laser light therapy, provides energy to the hair follicle through the mitochondria. When red light hits the mitochondria, it creates a chain reaction of anti-inflammatory processes and also energy production in the form of ATP. ATP is the currency of energy that the cells use. So remember, we spent a lot of time talking about how hair follicles are highly metabolic. But what if they're weakening? What if they're not producing enough hair or thicker quality hair? They're getting a thinner, shorter, wispier hair. If you impart energy to them and give them this surplus of energy, they're going to grow better hair. And that's how red light therapy works. But it takes time. We can measure results in about 90 days, see the results in the mirror in about 6 to 9 months, and see kind of the full final outcome of any treatment modality in about a year.
But even as you're saying that it takes that long to see results, just for me, when I change something for the better for my hair, I can feel it just sticking up off of my head a little thicker, or just having a little more oomph to it. And no one else is going to notice, but just putting my hands through my scalp, I can feel it. It feels thicker. It feels more like it's got more life to it. So you will start seeing that. I mean, it's just like with your skin. I mean, if you have a day or two of eating horribly, you look all washed out and nothing really structurally has changed. You just have less circulation to your face and less life to you. So you will start seeing things a lot sooner than that. I personally would believe, but
I would assume that you, Sara, and also those who are listening to this podcast are probably more on the sensitive side of things, meaning that they're just have a more, they're more sensitive to the changes that are occurring in their body. And so I would agree with you that certainly you're going to feel something. I notice that when I use the laser immediately, first of all, I feel a little bit of warmth, although the heat is not the trigger. It's just warm from the electrical currents actually going through that laser. But also I notice the blood flow. I can actually feel the pulsations in my scalp. Those, there's probably thousands and thousands of miles of blood vessels in your scalp, and they all start to dilate when you use red light therapy. So even if you don't have hair growth that first day, please, you're not going to have hair growth that first day. You're already increasing the blood flow to the area. You're increasing the oxygen. You're increasing the nutrients and fuel. You're turning on the sprinkler system to the garden, and you're shining a light on that garden, and those follicles are going to respond. It just takes a little bit of time.
Before we go on, I just want to take a moment to also talk about the mental part of it, because even as we're talking about this, I'm here feeling my scalp tingle because there's energy thinking about my hair, right? And my mom had COVID. She has a great head of thick hair, and she's like, Sara, I'm losing all my hair. It must be from COVID. And she said, I keep looking in the mirror and I'm focused on the fact that my hair's falling out. I said, stop focusing on your hair falling out, because when you think about it, it's only going to manifest in that. So that goes with any chronic disease or ailment. So as you're doing these things, imagine your hair growing thick and luscious and beautiful, and you'll only encourage better results. So I just wanted to bring that up.
Well, that's true. I mean, I'm big on intention. I mean, I think it's very, very important, no matter who you're working with, whether it be a board certified hair restoration physician like myself. You have to have faith that what they're directing to you in terms of information and therapies and treatments are going to work. That's going to be part of it. I mean, myself as a surgeon, in my training nearly 30 years ago, I saw many patients talk themselves out of healing well, just because of their attitude. And, if you talk to centenarians and you ask them their secret, once they get past like the bourbon and the scotch discussion at midnight and you get into the real deal, most of them will say PMA, positive mental attitude. Yeah. So anyway, it's very important. Amen. But I think, what you can experience is that positive, your body knows when something healthy is going on. Yeah. And certainly you can feel that in your hair. And COVID, it was no surprise, actually. People say, oh my God, I didn't know COVID was going to knock my hair out. Well, let me tell you, back in the day of the Spanish flu, that was the first time that febrile alopecia appeared in the literature. So we knew this was happening. We knew it was coming, because if you have a high fever for extended time, you're going to have a shedding phase. And they noticed this back in the 1900s with the Spanish flu. Usually the shedding would happen in about a month or so. And that was the same thing that we saw with COVID infection, hospitalization, and then also we saw it in conjunction with the vaccinations.
Amazing. Well, now we've got the science and the results, so you can't argue with that. Well, okay, beyond the red light cap, which is a no-brainer. That's easy, painless, no side effects. Probably could put it over your face and get an improvement in your face or another body part. What about PRP and stem cell therapy?
Yeah, so you're talking about the realm of regenerative medicine, which is really my wheelhouse. I've been a fan and a huge advocate for regenerative medicine for 20 years. We started with PRP years and years ago as a wound healing treatment. And that was really the first application. Looking at how patients would recover from a hair transplant was really my first interest in applying PRP. We didn't really have an idea at that time, 20 years ago, that it was going to impact hair. But what we found is that those folks that we used PRP at the time of the procedure, their pre-existing hair was growing thicker and better and stronger. And so we started to realize this is what's going on. There's inside the platelets, there are these powerful growth factors, which, yes, are good for healing. And of course, we want to do that if you're having a hair transplant. But these same growth factors, these same chemical messages that are in that biologic system of healing also can tell the follicle, hey, buddy, wake up and get growing. But there is some nuance to that. So in the early days, we didn't really know exactly what the platelet concentration should be. We didn't really understand how the preparation protocol or the delivery, the deployment of the PRP made a difference with our results. But now we do. And you mentioned in the opener that I've done over 14,000 PRP treatments in the practice, and that number is probably higher today because I have a PRP room that just goes all day long. And what we do there is we use a dual spin PRP process, which gives us a super high concentration of platelets. And we combine that, if we want, with biologic or synthetic scaffolds in the body so that we can get a powerful effect of hair regrowth that lasts for an entire year. But if you neglect to make the PRP correctly, you neglect to test the blood before you do the PRP, you neglect to test the PRP before you deploy it, then you're going to miss the mark. And unfortunately, a lot of non-specialists really have no clue whether they're even providing a platelet-rich plasma or something that doesn't even qualify. So that's kind of sad.
It's really sad. And I was actually just talking to someone about stem cell therapy for an injured back in our family. And, you hear about all of these different procedures, stem cell procedures, different, angles on them. And this doctor's the best and this doctor's the best. And then people come back to say it did nothing for me. And you're spending thousands and thousands of dollars. So what makes stem cell therapy work versus not work?
Yeah. So again, stem cell therapy in the world of regenerative medicine, whether we're talking about PRP or applying exosomes or even growth factors and peptides, I think those are all in that same bucket.
Right.
What you need, first of all, is a hair follicle. If the follicle is too far gone, it's a vellus hair, which means it's less than 2 millimeters in diameter, or less than 2 millimeters in length and less than 20 microns in diameter. That hair's not coming back. That's like the hair on your cheek. It's not coming back. So you need to have a very powerful microscope, and the artificial intelligence helps out with that to see which areas are most likely to respond to non-invasive treatments. So someone with extensive baldness that goes for PRP, they're probably looking for the result in a completely wrong area. Those follicles are completely gone already. So we have to be careful how we apply different variety of therapies. If there's a peripheral area around the crown zone where there's baldness in the center of the crown, but there's loss of that's thinning on the periphery, well, that periphery might respond very, very well to PRP, but that center portion is probably going to need some transplants. And so, adding things to the PRP like exosomes, which are stem cell messages, right? We don't use the cells in that particular case. We use just the messages that come from stem cells. That can be added to PRP. We can also use exosomes in conjunction with transplants to make the hairs grow faster. That's a pretty exciting new technology. I'm actually going to be presenting on that in Berlin at this next International Society of Hair Restoration and Surgery conference. We can also use your own hair follicles and your own hair follicle stem cells to create a stem cell derived treatment that's personalized and precise just for you. So there's a lot of new technology out there. Obviously, we don't have hair cloning yet. So we've still got to move some hair follicles around from your donor zone, the sides and the back of the scalp, if we're going to recreate coverage in some balding areas, or your eyebrows or eyelashes or sideburns or wherever you have a scar, those types of things.
Well, I love that you talk about the eyelashes and the eyebrows. People with hypothyroidism, they start losing their eyebrows. And then there was that period of time where making pencil thin eyebrows was in, and now everyone's penciling them back in because to make them look thicker, where you can actually do regeneration in those areas with the surgery.
You're talking about like going from the wavy brows of the 80s into the Kardashian era, I think, maybe what you're talking about, right? It's just so we're clear. Yeah.
Yep, exactly.
Yeah, I gotcha.
And then, doing the lashes and making them, instead of, it goes with the hair and the lashes. And I live in Southern California where you don't even know who's real anymore. The fake eyelashes, can only imagine what they're doing to your real eyelashes with that glue, and then the toxins that are in it and all of that, and the hair extensions that are just going to cause you to be more bald because they're pulling. Am I wrong as far as the damage it does to your hair?
You are not wrong. In fact, in the office today, just before we got on the podcast, I have a patient who's a child actor, and she had been using hair extensions, eyelash extensions, since she was at a very, very young age. And let me tell you, the chronic chemical processing of the hair with heat, and the extensions that she wore have taken a huge toll on her hair. And she has some hair loss in the family too. So again, which is the straw that breaks the camel's back? If you've got amazingly thick hair genetics, maybe you're okay with hair extensions and chemical processing, straightening, perming, and all of that business. But if you have thin, fine hair, and you try to hang a huge extension on top of that, you're going to cause what they call traction alopecia. And the traction is the pulling on the hair follicle. If you pluck the hair out of the follicle, you will remove biologic material. We know that because we can actually send some of that off for preservation if, God forbid it, we need to. But if you continue to pluck on a hair, just like those women that pluck their brows, those follicles eventually shut down. That's traction alopecia. And it's very common in the world of entertainment in Southern California. We have a lot of patients, men and women, who either have worn hair through wigs and weaves or hair pieces and toupees for many, many years. The women wearing the extensions and doing those styling things. So we certainly want to get a microscope on their scalp, get an evaluation going, get some measurements going. We call that hair check and hair metrics to see what's happening there before we recommend any kind of therapeutic intervention. But we know for sure that those can be really, really bad for your hair. So if you're wearing hair extensions, you got to feed the follicle with good nutrition. You've got to think about getting a measurement to see what's going on. Try to avoid extensions if you can, or modify the way those extensions are placed so that you can actually alternate the different follicles that are being attached. And look, if your hair extensions are 3 feet long, honey, we got to talk.
Right. Well, you add the extensions with the Ozempic, and you're going to be lost, right?
Oh my God. Welcome to Southern California. I went to school in Southern California, so I get it. I know. Yeah. I understand.
Okay, so the hair surgery, when is it time for someone to actually think about hair transplant surgery, and where do you get the hair from? How does the process happen?
So hair transplantation should be the last step in your process, right? You have to try to maintain your existing hair. This is really, really important, and especially for young folks that come in. And when I say young, I mean like guys that are my kids' age, like in their 20s. Those are the young folks I'm talking about. We need to make sure that we evaluate them properly. Let's take a look at their risk factors. How much hair loss do they have right now? What kind of things can we do to stop the progression of the hair loss? And let's handle that first. No one's doing a running jump into the hair transplant operation room until we can stabilize the hair loss process. And if you're doing that, if you're getting on a flight to a distant country where you don't speak the language and you're getting a hair transplant, if you think it's going to fix it, you've got a problem, and you're putting yourself at major risk. Not just risk, in terms of your health and wellness, and hopefully you come back with both kidneys, but even if the procedure is successful, how many people are going to be talking to you about stopping the progression of the hair loss in the other areas? You're going to be left with very little donor hair and a very big bald spot behind your transplants. Not a good plan. So evaluation is key. and maturity is most important. So it may not be a matter of age necessarily, but a matter of maturity. When is the right time to jump into a hair transplant procedure? But for guys, receding hairline, thinning in the crown, if you're noticing some hair loss there, we need to stop the hair loss, and we need to consider, what does it take to restore hair to those areas? And we're not putting your hairline back where it was when you were a teenager, 13 years old. We're going to create a natural and age-appropriate hairline that will fit you forever. So where do we get the hair? The hair comes from the sides and the back of the scalp. Those are the locations where the follicles are immune to the DHT, which, as we talked about earlier, DHT, public enemy number one. Those follicles, when we put them into the thinning or the balding area, provided we do it in a careful and artistic and technical fashion, and it heals properly, those follicles will produce hair ongoing, literally your entire life. Now, could you be stuck on a desert island with no protein? God forbid you need a cancer treatment or something. Of course, it's going to knock out your hair, but not from male pattern hair loss. Those follicles are essentially immune, very highly resistant. So that's why a hair transplant works. But then people say, well, what about the hair behind it? Well, that's where the medical therapies come into play. So with the hair transplant, you could do PRP, exosome therapy. You're going to do some hair homework. That might be medications like finasteride or minoxidil or a laser cap. You're going to tune up your nutrition. You're going to tune up your lifestyle factors that are all going to be influencing your hair over time. And that's where the total package comes together. The artistry, the technology, the evaluation, the diagnosis, and more of a holistic approach than any other place. And that's what I'm kind of known for, at Bauman Medical. That's what we're doing.
That's amazing. And because that's just non-existent around, with medical procedures, they just cut and place and you're out the door. No one's talking about nutrition. When I was diagnosed with PCOS, no one told me that it had something to do with my insulin resistance in my diet. No one told me. And here
PCOS, a very inflammatory condition. But if you think about that constellation of symptoms, whether it's weight gain, oily scalp, hair loss on the scalp, hair growth in other places, it's all this hormone imbalance, and it's all working together. So things like, I'm sure if you had someone with PCOS now, you put them on a low inflammatory diet, you can try a ketogenic diet, some other things, and maybe once you get that insulin resistance under control, it really starts to turn around for those folks.
Yeah, and even if you're suffering from insulin resistance and it's not PCOS, it's going to affect your hair. So insulin resistance is the key to most metabolic diseases, including hair loss. So that's why you have to focus on that diet and that nutrition in addition to this whole package of what you're doing for your hair. So many exciting things. I am guessing you're going to meet some of my family members eventually down in Florida. And it's so funny when I think about the fact that you're in Florida and people need to fly out to see you. If there's one thing that people will fly anywhere in the world for, it's their hair. Before I let you go, though, what is coming down the line in the innovations of hair?
Yeah, well, today, if you think about the surgeries that we do, the minimally invasive process, we're literally taking as little as a single follicle one at a time. But accelerating the regrowth of the transplants is one of the things I've been very focused on, as we talked about regenerative medicine with my beginnings in PRP 20 years ago. Now we're using exosomes to soak the grafts and grow the hair faster. Now, is that a major benefit for everybody? No, not necessarily, because at the end of the year, it's about the same. But if you have a wedding or a special event and you want to get that hair growing faster and quicker, we've seen some very exciting results with some of these latest and greatest exosome therapies like Juvexo, H, and things like that. But coming down the pike, everybody wants to know, when is hair cloning going to be available, Doc? That's like the common every day in the office. Hair cloning, do you have it yet? And I would have thought 20 years ago, I thought we would have had it by now, but obviously we don't. So we still have to treat the ongoing hair loss process because your donor zone is a finite amount, a limited supply, highly valuable donor hair follicles. We can't make more of them yet. But what we can do is take some of those follicles and, as we mentioned before, the hair follicle stem cells, and cryopreserve them. So we can put them in the bank, and we use those follicles as an insurance policy because I'm confident. I know I've got colleagues, smart people, not only here in the United States, but also around the world, that are working on hair follicle multiplication. And yeah, we're going to need a little bit of luck, but a lot of science too. And I think we'll have it. And so probably in the next 10 years, we're going to have some kind of hair follicle multiplication technology. I don't want to have to clone my 60-something-year-old hairs to get that job done. I want my 53-year-old hair follicles. So that's why a couple of years ago, I banked my follicles.
Nice.
And then the interim step today, obviously, is we don't have the cloning, but we can make a personalized exosome and secretome therapy from those banked hair follicles that we can then deploy onto the scalp as a hair growth treatment in the office. So I'm very excited about all of that. We're seeing more and more research come through on that technology. And so just stay tuned for it. That's really what all I got to say is a take-home message. And time is follicles, right? Because every day you're not on treatment, you're getting worse. So time equals follicles. So if you think you're losing your hair, you got to get on top of it.
Amazing. Well, where can people work with you and follow you and come and see you?
Yeah, I'm on this new thing called social media. So if you find me on social media, you can shoot me a message. But really, if you want to learn about what we do and you have a longer attention span than the social media stuff gives you, then go to the website. There's literally thousands and thousands of pages, 25,000 pages that I've written over nearly 30 years. So it'll take you some time to ingest some of that. There's also hundreds of hours of videos on all variety of therapies, treatments, diagnostics that we have, including the minimally invasive surgeries, like we mentioned, follicular unit extraction, and the latest and greatest in stem cell therapy and hair follicle banking and all of that. And if you have a question, you can go to baumanmedical.com/ask. And you can just type your question right in there. But baumanmedical.com, BAUMAN medical is the place to get all that information. And also, if you'd like to either connect with me virtually, that means online, like we're doing here with a Zoom or video call, or if you want to come in person to the office in Boca Raton, Florida, or visit me in my office hours in New York, then you've got to click a button there and fill out a few forms and we can connect. Whether it be your home or phone or, down the block from the beach over here in Boca, that's up to you. But I look forward to helping you with your hair restoration journey.
Amazing. Well, thank you so much. My mind is blown. I'm more at ease if I ever go through another hair loss experience in my life, that there's solutions, and same with my family members. So thank you so much for joining us today. And guys, this is one to follow. So thank you, Dr. Allen.
It's a pleasure to be with you. Thank you so much for having me on.
Gosh, I don't know about you. I wish I had all this information when I was going through my struggle. And it's always that fine tip of like, is it feeling thinner or is it feeling thicker? So it's going to be a lifelong journey for me with my hair. But as Dr. Allen was talking about, you need your protein. And this is where the accelerated aminos comes in. Most women especially are not getting in enough protein. And without enough protein, your body, your muscles, your skin, and your hair don't have the building blocks to build that hair. So it's just not going to. Most women, most vegans and women don't get enough. You want to get that 1 gram of protein per pound of body weight. And like I said, most people are not getting that. And you need to get it from the animal protein with all 9 essential amino acids. The accelerated aminos are the quickest amino acid supplement to absorb. It's very easy on your liver, where if your liver's backed up and you cannot break down your proteins and fats, this is your answer. So that is number 1. Number 2 is accelerated iodine. So your thyroid gland needs that 4 and 3 molecules of iodine for that T4 and T3. If you have sluggish thyroid, you're going to have sluggish hair growth, sluggish digestion, sluggish everything. And most people see hair loss. Accelerated iodine is the only radiation-free, toxic-free monoatomic iodine using the carrier of 200 proof organic non-GMO alcohol. Anything less, glycerin or less proof of an alcohol, makes the carrier less absorbed to get the iodine into all of the cells. The iodine also helps detox the halogens, fluoride, bromine, and chlorine that can block hair growth. And super important. And then to pair that is the accelerated thyroid that helps restore thyroid function. And without a healthy thyroid, you're not going to have healthy hair growth. But it has the bioidentical glandulars, Ayurvedic herbs, and key cofactors like L-tyrosine to support that T4 to T3 conversion. And it helps reduce hair thinning by improving the circulation, the nutrient delivery, and oxygenation to the follicles. So it is super important. And the fourth one, I mentioned liver. If your liver's backed up and you're taking in all this nutrition, but it's not assimilating into your body, it does your scalp no good. Accelerated liver care removes that toxic heat, the damp stagnation in traditional Chinese medicine terms that supports that phase 1 and phase 2 of liver detox. There are other ingredients that actually help regenerate the liver and help your hair growth. Imagine that. Hormonal imbalances, estrogen dominance causes hair loss. That estrogen dominance is mitigated with the accelerated liver care. So those are the supplements that are go-tos for helping with that hair growth as you embark on your hair growing journey. So thanks for tuning in to Accelerated Health with Sara Banta. I hope today's episode gave you the tools and inspiration to take the next step. You can head to SaraBantaHealth.com for my health articles, join my free group coaching on Telegram, and shop the supplements we talked about at Accelerated Health Products. Use coupon podcast10 on your first order. If you loved what you heard today, don't forget to subscribe, share this with your friends that are losing their hair, and leave a review. Doing so will help this podcast reach more people like you. You can find this podcast on Spotify, Apple, YouTube, E360, iHeartRadio, and over 100 different platforms. Remember, I'm live every Monday, Wednesday, and Friday, so join me next time for more ways to unlock your health potential.